A very good morning to all who has made along to this attend this webinar. Thank you each and everyone who is meeting me here. I would like to introduce the speaker of the day, Dr. Lawson Fangle, who holds a Master in Public Health Clinic Research. He currently works as a Chief Academic Officer and a Dean School of Public Health, Texila American University. So today he will take us through the briefing of things to know about the public health education to enhance your career. So we are much glad and geek to have you here, Mr. Johnson. So I think it's over to you now.
Thank you very much, Madam. Yeah, as I've already been introduced, so I'll proceed into today's presentation. I hope you're able to see my slides. So we shall look at the things that you need to know about public health as a career. And I'll give you an overview. We'll look at public health as a science and an art. Then the purpose of public health. We'll look at the core components and subfields. We'll look at different degrees offered in public health. And then we shall zero in and look at why should you study with Texila American University. One of the components of the reason why we should study with Texila American University, we'll be looking at course delivery, then our faculty profile, and indeed, we shall end with looking at what you will be or how your progression will be in the career in the field of public health. So let's start looking at the definition of public health. And I'm getting the definition, which is holistic, from Amory Winslow, who lived between 1877 and 1957, from the School of Yale, Public Health. So public health is both a science and an art. And the field is basically meant to prevent disease, prolong life, promote physical health and efficiency through organized community efforts, looking at the sanitation of the environment, control of community infections, health education to individuals in principles of personal health, organization of medical and nursing services for early diagnosis, preventive treatment of disease, and the development of social machinery, which will ensure to every individual in the community a standard of living adequate for the maintenance of health. So when you look at the fields of health practice, the major two components are clinical medicine and public health. Public health is a cornerstone of disease prevention. In well-organized communities and societies where there are very strong public health systems, there is very reduced risk of the spread of infectious diseases. And indeed, lifestyle diseases are reduced to a minimum, and individuals tend to live long. So the two, preventive medicine or public health and clinical medicine, are in synergy and they cannot be separated. So what's the purpose of public health? The purpose of public health interventions is to prevent and mitigate diseases, injuries, and other health conditions. The overall goal is to improve the health of the population and increase life expectancy. That's the reason that you see that in the developed world, this era of COVID, where there are public health systems are very advanced, individuals tend to live longer than in the developing world. What are the core components and subfields? So public health has sciences that feed into application. And the basic public health sciences are epidemiology, biostatistics, social sciences, scientific methods, and research. Then there's policy and management that guides public health interventions. And therefore, the core courses here are health policy, health services management, health economics, and public health policy. When the theory is gathered, knowledge, learning happens in the core courses. The individual that is trained is meant to go and apply that knowledge. So you develop the knowledge domain, and then that has to be translated into application. So in application, you have global health, disaster management, occupational health, environmental health, maternal and sexual and reproductive health, health promotion, health education, community health, behavioral science, mental health, and of course, health politics. So you can see that public health is both a science, as the foundation is on the basic public health sciences, and then it's an art, because whatever is learned in the basic sciences and the policy and management sciences is meant to be applied in the field. What are the degrees that one can come out with in the field of public health? Different schools offer different degrees, and they basically fall into categories. You have a professional and academic degree. When you look at the postgraduate degrees, the two major ones are Master of Public Health, MPH, and the Master of Science in Public Health. Upon qualifying in these two, one would either follow through upon graduating and do doctoral studies. And therefore it follows the doctoral studies will include Doctor of Public Health, DrPH, and Doctor of Philosophy in Public Health. And the Doctor of Philosophy in Public Health will fall into different specialties or disciplines of public health. What is the difference between the two qualifications? The MPH and DrPH are regarded as professional degrees, while the Master of Science in Public Health and the Doctor of Philosophy in a subspecialty of a public health discipline is regarded as an academic degree. We shall go further and try to understand the differences. So, when you look at the two, the MPH or DrPH, these degrees are meant for individuals that would choose to work in the field, implementing programs, managers in health facilities, and indeed researchers. While the individuals that follow an academic path or the academic path, these are the ones who end up in universities and take a career of lecturing and scientific research in the field of public health. So depending on what you want to be, whether you'd love to go into academia, you'd rather go for a Master of Science. If you want professional progression, then you'd go for an MPH, Masters in Public Health. So why TAU? Texila American University runs a Masters in Public Health, an MPH. I have given a distinction between the two. The MPH is a 2-year program. We have 1 year of didactic lectures, followed by a year of a combination of didactic lectures in the second year first trimester, running side by side with a dissertation, or indeed the project. The Texila program is a very flexible program and therefore runs on a trimester pattern. Basically, there will be 6 trimesters, 3 trimesters in the first year and 3 trimesters in the second year. In each of the trimesters, there are 2 courses that are delivered, and the trimester runs for 4 months. So there will be 16 weeks with 14 weeks of self-learning and interaction with members of faculty. We shall look at the delivery pattern on the next slide. Texila has highly qualified faculty, full-time, part-time, and indeed industrial faculty in the different specialties in public health. Apart from the master's program, Texila also offers DrPH. The DrPH is offered both at the Zambia campus and the Guyana campus. And so are the 2 master's programs, with a PhD program being offered at the Ghana campus. So for the DrPH program, the students are exposed to laboratory work for their basic sciences because they have to go through a semester of basic sciences. And therefore, Texila has the state-of-the-art laboratories for undergraduate students. These are the same laboratories that medicine students studying for the MSPH are exposed to. So you can see that these laboratories are of very high standards, ranging from anatomy labs, both wet and dry labs, physiology, microbiology, biochemistry, physics, chemistry, biology. Therefore, you get an undergraduate who goes through the core courses of public health well-rounded. The learning experience is augmented by contact classes. For the master's programs, there are contact classes that are conducted over the weekend, and it combines both virtual platform and on-campus platform. The local students are able to attend class on campus over the weekends, while the international students and those in the sub-region attend class on the virtual platform. This augmentation helps students understand the public health, basic sciences, management sciences more comprehensively, as most of the issues that the students could have had a challenge with during the self-learning sessions could have been taken care of. Then for postgraduate students, they go for field experience. I would ask them to mention that even the undergraduate students in their fourth and third year have industrial attachment. We have partnership with industries to do with meat production, biggest meat production company in Zambia, Zambif. Then we have partnership with government water and sewerage company, partnerships with the local council, and indeed the Environmental Council of Zambia, and indeed other components where our students would go for field experience. They also have hospital-based or health center-based experience and field experience going to look at primary health care and hands-on assess the determinants of health and disease in the community. So in case of course delivery, Texila has a robust e-learning platform. We use the learning management system, which is a very interactive and live system where academic administration and course delivery is conducted. On our LMS platform, the student curriculum, timetables, academic calendar, course plans are deposited in the LMS. And these are deposited well before a trimester or indeed a semester commences. Forms of communication with students on either administrative or academic matters are also made possible on the same LMS platform. Resource materials for students with linkages to different e-platform resources. There are links for different courses on the learning management platform or the learning management system. So among the resources that are there are PowerPoint slides which are deposited minimum 2 weeks before the contact classes. And there are also reading capsules which students can access to guide them in their study. Apart from that, on LMS, students can book for interaction with faculty and clear gray areas that they could be facing in their studies. In terms of assessment to augment learning, the model of the courses are such that each course has 4 modules, and each module has 3 units. Then after each unit, there are 5 questions, multiple choice questions that have to be answered. Salient points covered in that course. And this helps the lecturers to understand which areas require emphasis so that the student progression is unhampered or is enriched, and retention of knowledge indeed is enriched. Then there are case studies that students need to interact with and do critiques. Then there are capstone studies which fall in the second trimester and fourth trimester. A capstone study basically looks at the different courses that the student has taken, looking at the phenomenal theories, principles, and applications that have been learned in that field. And then the students will come up with a mini investigation to apply that knowledge in their field or in their place of work in real time, so that we understand whether the students are able to interconnect the different principles, theories, interventions that have been learned over the courses that have been covered. And then the student will write more or less a research report, the same format, the way the research profile runs. But of course, with about 15 to 25 words and running over a period of 6 weeks. This augments learning and promotes critical and creative thinking. Then apart from that, there are forum discussions. A discussion question in each of the courses is uploaded and the students respond to the forum discussion question. The response could be directly to the forum discussion question, or indeed a critique of what the other student has posted around subject matter. So assessments are composed of continuous assessment, and summative assessment. Continuous assessment, terminology sometimes, Texila terminology, it may be called internal assessment, and then the summative assessment, external assessment. So what does the continuous assessment compose of? It's basically the multiple choice, case studies, capstone studies, and the forum discussion questions. Then summative, at the end of a trimester, students have to sit for a summative exam, which contributes 60% to the overall mark. And then continuous assessment contributes 40%. Most of the times, the summative exam is composed of multiple choice questions. So this is a synopsis of academic delivery. If you look at our model, this makes the students concentrate on 2 courses over a period of 14 to 16 weeks. Of course, the last 2 weeks are for exams and results publication. By taking 2 courses in a trimester, this promotes deep learning and translates into better skills as the students are deployed or get to the fields after graduating as students of public health. Faculty profile. The university has 4 full-time profile. That includes myself, who's the dean and chief academic officer. I'm a medical doctor, basically with 2 specialties. I'm a public health specialist and an internal physician with super specialization in infectious diseases. So I hold a Bachelor of Science in Human Biology, then Bachelor of Medicine, and Bachelor of Surgery, that is MBCHP, Master of Public Health. Then I hold a Master of Science in Clinical Research, Fellowship in Infectious Diseases, and PhD in Public Health. These qualifications both acquired locally in Zambia, Germany, and the UK. I have a span of 21 years of professional and academic experience. Then there are 2 coordinators, Associate Professor Joseph Banda, who's a medical doctor also, holds a Bachelor's of Science in Human Biology, Bachelor of Medicine and Surgery, MBCHP, and a Master's of Public Health, MPH. Dr. Banda also holds postgraduate diploma in epidemiology and biostatistics. Equally, he has 21 years of professional and academic experience. Then the other coordinator is Assistant Professor Emmett Sakala. Emmett Sakala coordinates the bachelor's degree, while Associate Professor Joseph Banda coordinates Masters of Public Health. Mr. Emmett Sakala, Associate Professor, has experience of 12 years, both as an academician and as a profession, and holds a bachelor's in public health, bachelor's in business administration, in accounting and finance, master's in public health, and a master's of business administration in finance. An assistant professor, Justin Chandler, 10 years of professional and academic experience. He holds a BSc, Bachelor of Science in Evidence-Based Practice, holds a Master's in Public Health, and also a Diploma in Nursing. In terms of part-time faculty, we have 4 part-time faculties. 1, a biostatistician with a Master's in Biostatistics and Epidemiology. 20 years experience. We have 1 specialized in environmental health, 1 specialized in maternal and child health, and 1 specialized in behavioral science. If you remember, these 4 under core courses and indeed courses in application. Then, since the field of public health is practical, it's very important that as the learners go through the training, we also expose them to industrial faculty. So we have 5 industrial faculty that we've been given, coming from the industries that I mentioned earlier on, and we call them as guest lecturers to come and give lectures on topical issues of their choice. So what is your career progression? For medical doctors, physicians, this takes you into a path of becoming a public health physician. Then 1, either a physician, biomedical scientist, maybe a nurse, pharmacist, environmental health specialist. You may choose to get into epidemiology and you become an epidemiologist. 1 may choose to go into biostatistics and you become a biostatistician. Then some of you will choose to be researchers because public health makes you a well-rounded researcher, health services administrator, and policymaker. So apart from being a researcher, 1 can be a health care administrator. For nurses, you specialize, you're public health nurse. Then some of you will be public health project managers. Some may choose to go into health informatics and be health informatics specialists. And some of you may opt to be healthcare consultants. As I indicated earlier on, there are some individuals that may opt to go into academia and become lecturers like myself and my other colleagues. So the field is open, opportunities are wide. And when you look at the WHO and most of the NGOs that have to do with disease prevention, be it HIV, COVID, tuberculosis, they prefer an individual that studied public health. Bachelor's, master's, and PhD level. Why? The reason is simple. This is an individual who's well-rounded. They're rounded in management. They are strong in research. So they would better understand and interpret findings better. And they would administer or manage the projects or institutions better. That's the reason they would not pick a pure clinician, like maybe a surgeon, an internal physician, or indeed a nurse, or a biomedical scientist without public health. What would be preferred is someone who's all-round. They are strong in the basic sciences. They are strong in clinical sciences, nursing sciences, but also strong in administration, research, and indeed are able to interpret and understand research findings. And then public health makes you be very relevant when you attend international conferences, because at your fingertips, you have your epidemiology, you have your biostatistics. So even when there's a paper presentation, you tell the difference between research which has flaws and indeed research which is strong. And you'll be able to tell which research you can use for your interventions, because you know that practice in any field now has changed. It's evidence-based practice. So wherever you will be, you will require knowledge from public health, because there's no intervention, whether in the field or in the clinical field, where you can make decisions without taking into consideration the best evidence that is available. So modern day practice, public health is the cornerstone, or indeed backbone for any form of practice in the health field. That said, I'd love to thank you for listening to me. And I'll end here. If there are any questions, we may go into question answer session. I thank you for inviting me and having me for this presentation on career progression in public health. I thank you.
Thank you very much, Mr. Lawson. It was indeed a great presentation. You explained a really great thing. Thank you so much. I hope like all the attendees would have like benefited out of this presentation. Thank you so much. Thank you. Thank you for having us.
Thank you, madam. Thank you for having me.
Thank you so much.